Good day, dear friends. With you is Natalia on the channel Dr. Savkina, on which I share my personal experience and answer your questions. In the last video, we talked about the causes of the feeling of numbness in the hands. I want to emphasize that there is no point in treating numbness in the hands without eliminating the cause that caused it. If numbness in the hands occurs at night during sleep in an uncomfortable position, it means they are simply pinched. And performing a set of exercises can help solve the problem. But if the feeling of numbness in the hands arises spontaneously, it is necessary to determine the cause of this phenomenon. I've already talked in detail about the causes of hand numbness in my previous video. Today, we will focus on the treatment of this ailment. So one of the most common causes of hand numbness is poor circulation, primarily in the neck and brain area. This is quite a serious problem, which in some cases can lead to the development of a stroke. Contrast baths for the hands will help in this situation. For this, it is necessary to prepare 2 basins with cold and hot water. First, the hands are lowered into cold water, then into hot water, repeating this procedure 5 to 6 times. After this, it is recommended to thoroughly rub your hands and wear cotton gloves for a few hours. A large role in the treatment of hand numbness is given to performing a complex of therapeutic physical exercises, which contributes to the restoration of normal blood circulation in the fingers and hands. I, for example, perform 5 exercises twice a day every day. So first of all, we clench and unclench our fingers. Doing this exercise, we clench our fingers into a fist for 3 seconds, holding in this position for 3 seconds. And then we energetically flick our fingers upwards, spreading them out. We repeat this exercise for 30 seconds. Next, I make circular rotating movements with the wrists and hands clockwise and counterclockwise, approximately like this. I repeat this exercise for 30 seconds, approximately 8 times to one side and 8 times to the other. Then we turn the wrist and try to reach the right forearm with the fingers of the right hand, and we assist with the left hand while doing this. In this way, we stretch the wrist. We perform this exercise with the left wrist as well. In this way, repeat for 30 seconds as well. Next, we try to stretch the right arm to the opposite side. In this way, we help ourselves with the other hand. We do the same thing with our left arm. We also hold this position for 30 seconds. Then, over the next 30 seconds, we stretch our fingers. I do it like this. And then each finger separately. In this way, we improve the blood supply to the hand tissues. Thus, we thoroughly knead each finger for 30 seconds. All this takes me just over 3 minutes. But it really works. As practice shows, a warming compress helps to restore the sensitivity of the hands, which includes 10 milliliters of camphor and 50 milliliters of rubbing alcohol, diluted with a liter of slightly warm water. In this composition, a teaspoon of sea salt is dissolved, and with this solution, we rub our fingers and the brush of our hands directly before sleep. In the case where the cause of hand numbness is osteochondrosis of the cervical spine, medication is prescribed, primarily vasodilating drugs. Vitamins of Group B, analgesics and non-steroidal anti-inflammatory drugs in the form of tablets, injections, gels, and ointments, with the help of which pain, inflammation, and a feeling of hand numbness are effectively eliminated. In the case of hand numbness caused by carpal tunnel syndrome, glucocorticoid injections are successfully used. However, there is one but. The effect of treatment in this case depends on the professionalism of the doctor performing this manipulation. The invaluable role of physiotherapeutic methods of action. Acupuncture, in other words, reflexotherapy, helps to restore the normal functioning of nerves. A method of acting on biologically active points. Electrophoresis with lidocaine primarily helps to eliminate sensitivity disorders. In some cases, phonophoresis with hydrocortisone ointment is quite effective in dealing with the feeling of numbness in the hands. Many patients find manual and shockwave therapy helpful in reducing pain syndrome and the feeling of numbness in the hands, as well as osteopathy, a gentle technique aimed at relieving muscle and connective tissue tension, which causes a feeling of stiffness in the hands. If your fingers and hands are numb, wear a silk thread as a bracelet on your wrist and do not take it off. It has been established that skin contact with natural silk significantly improves blood circulation, and over time, the problem of hand numbness goes away. A great prevention of hand numbness will be a glass of warm water drunk in the morning on an empty stomach. One of the causes of hand numbness is a deficiency of vitamin B12 in the body. Most often, your body simply does not absorb it. This situation arises with atrophic gastritis and certain liver diseases. Intramuscular administration of vitamin B12 helps to solve the problem with anemia. Remember that the most common cause of hand numbness is diabetes. That's why it's so important to monitor your blood sugar levels and react in time to its fluctuations. In this situation, a prescribed hypoglycemic diet, sugar-lowering drugs, and insulin therapy can help solve the problem with hand numbness. I'm not unfamiliar with the problem of hand numbness in sleep. I am saved by the course of therapeutic exercise, which I showed you at the beginning of this video, and a hand and wrist massage. I do it myself, and in exceptional cases, after long work at the computer and with enthusiasm given to the forces on the garden plot, the best remedy for sleepless nights spent because of numbness of fingers and wrist for me is a potato. I take a medium-sized potato in my hands, put on clean cotton gloves on top so as not to drop the potato out of my hands in my sleep. And so I spend the night peacefully. This unusual event helps me avoid the feeling of numbness in my hands while sleeping. And how do you protect yourself from this discomfort? Write in the comments, I'm interested. You were with Dr. Savkina. Subscribe to my channel so you don't miss many new, interesting and useful videos. And be healthy.